the President of the Pacific Society for Reproductive Health, Dr. Alec Ekaroma, the Vice Chancellor of the University of the South Pacific, Dr. Rajesh Chandra, who's here in spirit, the Chancellor of the University of Fiji, Mr. Iqbal Janif, again, he's here in spirit, the Acting Vice Chancellor of the University of Fiji, Professor Rouse, the Permanent Secretary for Health, Dr. Matthew Sela Tuizakau, the UNFPA Director and Representative, Dr. Lauren Zesler, who's here in spirit, the Acting Dean of the University of Fiji and President of the Fiji Obstetrics and Gynecology Society, Professor Rajat Ganeshwar, the President of the Fiji Midwifery Society, Matron Aliot Ngalubakandua, distinguished guests, ladies and gentlemen, friends. Good afternoon, Nisam Bulavinaka, Salam Alaikum, Namaste. I am indeed honored to be here with you this afternoon to open the 11th Conference for the Pacific Society for Reproductive Health. I extend a very warm welcome to you all on my own behalf, as well as on behalf of the government and the people of Fiji. Your theme, quote, Reproductive Health in the Pacific Beyond 2015, Greater Investment and Partnerships for Improved Results, unquote, is exceptionally appropriate for several reasons. Your society is a classic example of great partnerships. You have invested your energies since your creation 22 years ago in building partnerships within the medical professions. You have, for instance, brought together nurses, midwives, doctors, and obstetricians and gynecologists from most of the Pacific Island countries, as well as from Australia and New Zealand. Your members are now partnering the various Pacific Island governments through their respective ministries of health. You have also extended your partnerships with professional organizations such as the Fiji Midwifery Society, the Fiji Obstetrics and Gynecology Society, and importantly, the development partners such as UNFPA, WHO, AusAid, and New Zealand Aid. Critically, you have included the Fiji National University, the University of the South Pacific, and the University of Fiji. This ensures that your knowledge base is broad and holistic. It is particularly pleasing that you are using your networks for professional development of your members, linking scientific research and theories with clinical practices and experiences. These, in turn, contribute to the significant improvements to issues like women's health. You also encourage ongoing research within key areas in the Pacific so that data is available to inform policy decisions. I am informed that you have already had workshops in 8 critical areas of your profession. You have been assisted in this by international faculty from the United Kingdom, Australia, and New Zealand. Many of your faculty are former citizens of Fiji. It heartens me, as it heartens many in Fiji, to see them re-engage with their Pacific colleagues. This partnership between the Pacific diaspora abroad and the professional colleagues in the Pacific is an important strategy to improve local capacity to tackle women's health issues. I note that the workshops cover important areas such as family planning, emergencies in obstetrics and neonatology, ultrasound, avoiding surgical complication, colposcopy, and research. Later on this afternoon, you are launching the Pacific Emergency Maternal and Neonatal Training Manual and the Pacific Journal of Reproductive Health. I congratulate you on these initiatives. Both these initiatives are targeting important areas of capacity development and sustainability. From tomorrow, you have an interesting and wide-ranging series of presentations and discussions on important topics which will no doubt progress women's health in the Pacific. I am glad to note that you are tackling the important area of promoting family life. The integrity of the family is vital. This subject must be pursued with vigor. Life in the Pacific is changing, and lifestyle behaviors are threatening the health of our people. The scourge of non-communicable diseases continues to grow and is challenging our health systems. Cervical cancer, a preventable disease, is killing the women of the Pacific. Many pregnancies remain unplanned. Teen mothers remain a cause for concern, and sexually transmitted infections are prevalent. I note that you are also discussing team building in clinical practice. This underscores the need for all of you to work together, bring in your different levels of experiences, build on your strengths, and help each other so that together you can look after all those who depend on you for their health care. I know that one of your major partners in this conference is the UNFPA. This organization has had a long and distinguished presence in the Pacific. I am advised that the UNFPA has been supporting the society since its formation over 2 decades ago. I hope this relationship will continue as an example of investment and partnership for improved results in reproductive health in the Pacific region. This year sees the end of the Millennium Development Goals and the beginning of the Sustainable Development Goals. I look forward with interest to the role your society and its partners will play in the implementation of the SDGs. Women's health remains vital. More attention to strengthening families is important, and professional development essential. The Healthy Islands settings seeks to sustain Pacific Island societies by protecting the respect and dignity of all its people, including protecting and nurturing children, treating all with dignity and respect, ensuring zero tolerance for domestic violence and gender-based violence, and treating the environment with a sense of pride. We in the Pacific have a natural environment which is beautiful and bountiful. Our people should be enjoying good health and not succumbing to disease. I am therefore happy that you are not just concentrating on only esoteric clinical issues, but that you are also addressing those social determinants of sexual and reproductive health which have a serious impact on society. Our people must be empowered to avoid behaviors which carry health risks. They must be empowered to fully enjoy life's potential. Your conference will undoubtedly be of great interest to all our Pacific people as we continue the journey towards sustainable development and healthy living. Like many of your partners, I look forward to learning of the outcomes of your deliberations in the near future. All I want to say now that it's good of you to ask me to be here today, and I'm very appreciative of that invitation. And I just want to thank you, and Vinaka Bogalevu, Shukriya, Dahut, Dainavad.